I'm pretty sure you're like, okay, Winnie, where exactly are you? Well, as you can see, we are on a red carpet with this beautiful decoration here, and that is because today the Aga Khan University Hospital is launching an executive and specialty clinic right here in Karen, all right? And of course, as you can see right over here, we have this huge placard that says the Aga Khan University Hospital Karen Specialty and Executive Clinic. And of course, this is where you'll get myriad of services that you need, all right? From the executive wellness all the way to ultrasound, laboratory, pharmacy, ECG, echo. And there's something that I have noticed, all right? And here it says exercise stress test. So what exactly is that? Well, come with me. Let's talk to the CEO, and of course he will tell us first of all why it is important to have like neighborhood clinics, but at the same time also ensure that people have access to the healthcare services that they need without having to travel so far, all right, for them to get all these services. Of course, this is the reception, very beautiful. There's a pharmacy actually over there where you can get all your medication, but for now the CEO is already waiting for us, and of course you do not want to keep a CEO waiting, do you? Absolutely not. All right, so come with me. Thank you very much, sir, for sparing your time this morning to speak with us right here on Your World.
Thanks for having me.
Most welcome. So there's an ICRA analogy, sort of like value that you've talked about, which I really find it interesting. So first of all, can we just start from there, and then we'll talk about like Aga Khan in general.
So like all institutions, we also have our principles, our value system. And for Aga Khan University Hospital, our values are IQRA, which is ICRA. Impact, quality, relevance, and access. So every intervention that we do, every project that we start, we have to make sure that we are abiding by our values. So are we making an impact in the communities or in the populations that we exist? Are we delivering the quality healthcare or quality education? That's Q. Are we relevant? If you look at Africa and the disease burden of NCDs, the non-communicable diseases, are we relevant today? Are we doing relevant research today? Are we doing relevant education programs today? So that's R. And then access. Are we providing access or creating access to the less unfortunate in our societies? So the outreach medical centers, and the Karen one being one of them, the idea is to provide access, to take the patient, to take the services closer to the patients and do it cheaply. And plus we have a patient welfare program as well, where we spend 350 million shillings every year, and it's growing in double digits. So that is to provide access as well. So that's IQRA. Impact, quality, relevance, access.
I like that. And a lot of people would refer to you as numbers guy.
Yes, I am.
The numbers person. And you talked about the fact that Aga Khan University Hospital treats over what, 7,000 patients?
700,000 patients every year.
Patients in a year, which is huge.
Yes.
So when we talk about then the impact that Aga Khan University Hospital is giving up, and not just as a hospital,
sure,
but also as a teaching hospital.
Sure.
Would you quantify that?
So I think that is very important. It's a very important question, and the definition and the answer keeps on changing every day. So treating patients, any medical facility does it. So we treat 700,000 patients who come to us, and we will continue to treat them. But the important thing is, what are we doing for tomorrow? Are we doing wellness programs for our patients for tomorrow? And we are doing that through our outreach centers. Are we training the doctors and the nurses for tomorrow? We see there are times where people from Kenya, they migrate to elsewhere, other countries, because the grass is always greener on the other side, and when they migrate, they tend to stay there. So are we creating and are we educating enough doctors and nurses, and good quality, who can actually stand in international universities and international forums and represent not only our institution but our country, Kenya? So that is what we are looking at. The third thing is about research. That's why I say the answer keeps on changing. New technologies, new therapeutics are coming out every day. And many of these research, unfortunately, that we see is happening in developed world. So what we are trying to do is bring that research to this part of the world as well. There are a couple of public sector institutions like Camry. They are doing fantastic job, and we partner with them, and we will partner with anyone who want to bring that cutting edge research into this part of the world. Now we are looking at artificial intelligence, right, and how the healthcare landscape will change in the next 3, 5, 10 years. So you have to be relevant. If you are relevant, then only you will make an impact.
And is that something that you'd say Aga Khan has helped Aga Khan stay relevant? Like you said, almost,
for almost 65 years.
65 years, yes.
65 years. We started in 1958, before the independence, and we started as a primary care hospital, but over time we have graduated. We are now a tertiary care hospital, and my goal is that we continue to expand our outreach centers to create access. We continue to expand our patient welfare program. We continue to expand our research portfolio. We continue to expand our education agenda. And also, I'm very passionate about inbound medical tourism. So people who are in other parts of Africa and are in need of good quality healthcare, they can come to Kenya to get good quality healthcare, which is of international standards.
Yeah, and I mean, getting the international certification as well, which is huge.
It is, absolutely.
Yeah.
The Joint Commission International, which is a gold standard from US, the College for American Pathologists for our laboratory services, it's again a gold standard. Now we are going into the clinical program certification, Center of Excellence, as we call it. We got it one in 2020. We were the first to get the CCPC, Clinical Program Certification for heart attacks. And in 2021, again the first, we got it for acute stroke program. And we will continue to invest in quality agenda. And it is important for us. It is more important for the patients, and it is also important for patients who are outside of Kenya and in need for healthcare. So if you are looking for healthcare, you would do a web search, you will ask your friends and your family. When you do a web search, it should show that Kenya has that international level institutions, and we benchmark against the best in the world. So these certifications, these accreditations are not from Kenya, they are from US, they are from UK, they are from other European countries. So we are benchmarking ourselves against the best in the world to tell the patients that we are equally good when it comes to healthcare.
Absolutely, and I like that. I mean, and even what, like, we're launching, today the 52nd, outreach center, which is absolutely huge. But I wanted to talk a little bit about teaching as well, and offering training, which is available. Sure. Because, like you rightly say, a lot of people, and especially here in Kenya, would travel abroad. Correct. To get the treatment that they desire. Sure. So how important is it, and especially for the Aga Khan University Hospital, to invest heavily when it comes to training of the MDs and doctors, just to make sure, like you're saying, that we ensure we have the best in it?
I agree, and it's an important question, and something that is very close to the institution's heart, my heart as well. In 2005, our Chancellor, His Highness Aga Khan, he put a U in the name. It was Aga Khan Hospital. Yes. Then it became Aga Khan University Hospital. So he knew, and we know today, that investing in education, investing in good education, academic programs will sustain your future. When you talk about sustainability, sustainability comes in different shapes and forms. There is financial sustainability, there is health sustainability, right? So the health sustainability, financial sustainability of the institution will come, and of the country will come, when you spend money on your younger generation, so on education. So this hospital, I think we are the only private hospital which is a teaching hospital. There is no other private hospital which is a teaching hospital. We spend close to 800 million shillings every year on academic programs. School of Nursing, Medical College, Research, Institute for Human Development. So why do we spend these 700, 800 million shillings every year? So that we can sustain ourselves for tomorrow. Not only as an institution, but us as a country.
Absolutely, I like that. So then the bigger goal for Aga Khan University Hospital, because like we said, it's one thing to invest in health, but it's also another thing to invest in offering training. Sure. And making sure that as far as affordability of these services is concerned. And of course, like we all know, that Aga Khan University Hospital, and you're pioneering investments when it comes to all these things. So the bigger goal for Aga Khan University Hospital?
Bigger goal?
Yes.
Oh, there are so many. I don't think I have one goal. I think
Yeah.
make Kenya the hub of medical tourism when it comes to Africa. That's number one. On the service side, on education, expand our education programs. As I said, we do very many advanced training programs for the medical doctors, which are called fellowship programs. We do fellowship in cardiology, in neonatology, neurology, medical oncology, hematology. So continue to expand so people do not have to go outside of Kenya to get advanced education and advanced training. So that would be goal number 2. Goal number 3, continue to invest and sustain our quality agenda, which is because what is closest to the patient's heart? When you come to a hospital or medical facility, what is the first thing that is on your mind? To get better for yourself or for your loved ones. So the quality healthcare, so invest in it and sustain it. So that would be goal number 3. Goal number 4, I think invest in research, new knowledge. I think if you look at Africa and many other developing countries, we have always been the users of knowledge.
Yes.
We have to be creators of knowledge. And that can only happen when we spend money and time and energy on education and research.
Yeah, and I mean, and talking of research very quickly, I mean, I understand there's something going on as far as the ARVs is concerned, which Aga Khan University Hospital is heavily invested in.
Yes.
Yeah, do you want to tell us a little bit about
Sure.
that?
So, in the midst of COVID, in 2020, we started CRU, which is Cancer Research Unit. Cancer Research Unit, which is headed by Professor Mansoor Saleh. He is a full professor from University of Alabama. We recruited him. He is originally from Zanzibar, so it was homecoming for him. He has started the Cancer Research Unit. And what we are trying to do in the Cancer Research Center is that we will be doing research on the chemotherapy molecules, right? So to test the efficacy of the chemotherapy on the African patients, on the Kenyan patients. So this is just a start. Research is a very long journey. There are many failures in the research as well. Not everything is successful, but I think we have to be at it. We have to be tenacious, and we have to be committed. And I think Aga Khan University Hospital is committed to creating new knowledge.
Absolutely. I love that. Thank you very much, Mr. Rashid Kalani, CEO of the Aga Khan University Hospital. Thank you for your time.
Thanks for having me.
Yeah, you're most welcome. Well, great insights over there from the Aga Khan University Hospital CEO, Mr. Rashid Kalani, as far as investing in not only health, but also training of the healthcare providers so that at the end of the day, people can get quality healthcare services that they need. So now come with me. Let's meet the Aga Khan University Hospital's Chief Operating Officer, Outreach Network, Mr. Kuram Jamal, who will take us through how important it is to have especially neighborhood clinics so that people can get some of these services that they need and also improve on the same. And Mr. Kuran, it's really, really nice to see you again.
We do.
Thank you so much for hosting us this morning. And of course, first of all, 52nd
52nd, that's correct.
Clinic launch day. Do you want to just take us through, first of all, this particular launch and what it means for Aga Khan University Hospital?
Very important day for us today. This is the 52nd clinic in our ever-expanding network of outreach health medical centers spread across East Africa. Very important day because we have entered a new market. We're now located in Karen. We want to serve the community of Karen. As we've said in the past, one of the key core values of the Aga Khan University is access. And this is us trying to bring services closer to the patients in the communities where they live and how we can create impact in their lives.
Yeah, and why is this so important for Aga Khan? Because again, like we're saying, as a country, we're doing so much in terms of improving healthcare services, but also bringing them closer to the people. How important is this, not only to the people, not only to Aga Khan University Hospital, but really to the, the larger community in the country as well?
So very important. I mean, we have seen and done studies that demonstrate to us that not everybody in this country has access to quality care, right? And not everybody can go to the main hospitals wherever they're located. For instance, we cannot expect all the people in this country to come and visit us in our main hospital in Parklands, and therefore we are trying to bring services closer to them, right? So access to quality care is very important. people don't necessarily have this access, and the underprivileged, and we want to really try and ensure that this care that we want to provide to patients is there for everybody that in the different communities.
Absolutely. And when it comes to this particular clinic right here in Karen, it's an executive and specialty clinic. Do you want to tell us a little bit about that and some of the services that are offered here?
Sure, sure. So this is executive and specialty. So let me talk about the executive, because that is the wellness program. So we have different wellness programs for adolescents, and for the elderly, for mid-aged people, men, women separately, right? So you would come and you would see our renowned specialists here. To start off with family medicine, they will do some blood works, and everything that we include in the different packages based on the different categories is evidence-based. So our teams of family medicine physicians, or the obstetricians, the pediatricians, people from the cardiology team, they've all sat together to come up with a different wellness program for each of the different categories of, different ages. So that is the wellness part. And then we also have the specialty clinics. This is very much similar to the Peponi specialty and executive clinic that we have in Westlands. So different specialties including cardiology, pediatrics, obs and gynae, family medicine, dermatology, name it. Several different specialists have already started running clinics in this facility. At the same time, this is going to be a one-stop cardiac care center as well, simply because we have the stress test and the echo and the ECG services. We're also introducing other diagnostic imaging, which includes the x-rays, the ultrasounds, the mammography. We have a fantastic laboratory over here in this facility, along with a full, well-stocked pharmacy as well. So it's a holistic care where outpatients can come. We will look after the specialized services. Anybody who is interested, has a need for them to be seen by a physician, they'll be able to be served very well in this center.
Yeah, because I think one of the major concerns that people might have is, fine, it's good to have a neighborhood clinic, right? But then again, will I get the same services from a major hospital? For example, the main, and that is on Limuru Road. So you're saying, well, people will get most of the services here?
Yes.
Okay, all right. And when it comes to the cost of the same, right? Do you see this, and that is, having so many outreach centers, so many neighborhood clinics, do you see this as a way of helping also improve when it comes to affordability? Because we all know how expensive healthcare in the country can be.
Definitely, yes. A very important question. So creating access means, providing affordable care. Okay, so if we're not providing affordable care to patients, then, why are we here, right? So what we have tried to do is we have spent a significant amount of our time introducing a differential pricing model for different communities within and outside of Nairobi. And I'll give you an example. So all of our 5 clinics that we have in the Mount Kenya region and 3 or 4 of our facilities in the Rift Valley region, the consultation fee in those centers is now 700 shillings, cash and corporate.
Oh, nice.
Okay. Similarly, our recent facility that we opened in the northeastern part of Kenya in Wajir, the consultation price there is 300 shillings. All right. So what we're trying to do is we're trying to create access. If our facilities are not accessible by the patients, then, as I said before, we're not being relevant to the communities, right? So, in fact, even our consultation fee to see a specialist in any of the outreach medical centers is roughly 20% lower than the same specialist that you would see in the main hospital. The most recent facility that we opened in Roysambu, the specialty care center, where we're doing daycare surgeries, which is a very good relevant example. Those day cases that we're doing there, the prices for those day cases is roughly 40% lower than the main hospital. So the prime objective is to provide affordable quality care and create access for all the patients.
I see that. So 52 launched today, and of course many more to go. And of course, last question to you would be, what next?
So we will continue on our journey for expansion and growth. We are now currently seeing across the network of 52 medical centers nearly 400,000 patients annually.
Oh, wow. Okay.
And I am trying to see and figure out a way, and we've put in this goal for us on how we can achieve to get to 1 million patients across the network,
in a specific
perhaps in
timeline?
2 years' time.
Oh, 2 years, okay.
So expansion definitely is a great strategy that we are working towards, and we will definitely be looking to newer towns and newer counties where we can set up such facilities.
And we look forward to that. 2 million. I mean, 1 million in 2 years.
Yes, 1 million in 2 years.
I'm being over ambitious. But thank you so much for your time. Really today, that is Mr. Kuram Jamal, who is the Aga Khan University, Aga Khan University Hospital CEO Outreach Network, for also giving us all those insights. I know a lot of you who are watching us this morning are thinking, okay, can we see the hospital? Yes, you will see the hospital after this break. Stay with us. This is Your World.
If you value it, insure it. Manage your unforeseen medical expenses through medical insurance. Be sure to understand the terms and conditions in your insurance policy, such as waiting period, pre-existing conditions, your obligations, and the policy limits. Check the sub-limits in your cover to understand the maximum amount of cover per medical condition. Stay prepared for medical expenses by having medical insurance in place. Now you know. IRA, promoting insurance, protecting the insured.
Africa Energy Forum's 25th anniversary is in mainland Africa for the first time. It will be held from 20th to 23rd June in Nairobi with the official endorsement of Honorable Cabinet Secretary Davis Chirchir, Ministry of Energy and Petroleum. Find out more at www.africaenergyforum.com.
Pata taarifa teke na e-paper. Stay in the know on the go. Getting the full story Bilangori. To sign up, choose your preferred subscription. Use the promo code SUBZ22 to get 20% off and pay. Get your favorite newspaper and enjoy the truth anywhere, anytime. For inquiries, email epaper@ke.nationmedia.com or call 0790 111 111. Subscribe today and get your taarifa teke.
The new Kerugoya Level 5 hospital now offers an array of services for which patients were earlier referred to the Kenyatta National Referral Hospital in Nairobi, an expensive affair that could at times cost lives due to loss of critical time between diagnosis and treatment. Standing tall in Kerugoya town in Kirinyaga Central, the magnificent 5-story state-of-the-art medical complex, which is the Governor Anne Waiguru's flagship project, is a dream come true as envisioned in the county's development blueprint, the Mountain Cities 2032. Kerugoya County and Referral Hospital is a premier facility that can only be compared to some of the best private hospitals in the country and is now viewed as a game changer in the county's health service delivery.
Going into the Champions League final, there were surely doubts and queries about Manchester City lifting the one trophy it desired and had yet to win. There was no doubt about City's ability, only whether it would finally get the job done. Consider that doubt erased as Manchester City is now the champion of Europe.
Blueband peanut butter, made with 100% pure peanuts and a good source of omega-6. Grow healthy and happy kids with Blueband peanut butter. Available in 200 grams, 400 grams, and 800 grams. Buy a pack today.
No bunga fagi pendene lace de mysteri. No bunga ti browse on flick ne mysteri. No bunga me gonna next week ne mysteri.
Only On the Trend at 10 p.m.
The Trend in association Techno Common 20 series.
This is NTV.
All right, welcome back. The show is Your World, and of course today, like we said, we are not in the studio. We have like a mini studio right here at the Aga Khan University Hospital, current specialty and executive clinic, where they have launched their 52nd neighborhood clinic. All right, and of course I know during the first part, majority of you are like, fine, we get it, but then again, can we see the hospital? Well, let's meet Dr. Logan, who will help us, take us through and just help us understand what this is all about. Dr. First of all, how are you?
I'm good. How are you?
Congratulations on the new launch, right?
Thank you.
And of course, I'm as curious as so many other people who are watching us this morning, and they're like, fine, it's a good thing to know about the neighborhood clinic and all those things, but can we see the hospital, right?
Sure.
So where do we start? This is the reception?
Yes.
Beautiful.
So this is where we meet all of our clients. Anyone who comes in, this is where they start from. And you'll meet the lovely lady here at our front desk who will guide you if on whatever service that you need. Sometimes some people just want a pharmacy service, sometimes some people want imaging service, others want the consultation.
Okay.
Yes.
All right.
In terms of the consultation, we have a range of specialties. Like myself, I'm a family physician. I'm here every day of the week. And then on and off, we also have faculty from the university, from the other specialties, from pediatrics to adult medicine, that's internal medicine, to surgery, to ENT. They always come here and you can get served.
Okay,
Yes.
I like that. All right, so like you said, the pharmacy is right here.
Once anyone who's needed a consultation, they'll be sent to these other departments. So let me show you which departments.
Sure. Where do you want us to start? I'm in your way.
Yes. Let's
Okay. So like I said, pharmacy.
So
the medications that you need, right?
This is our pharmacy where we have both medications and drugs that can be used within the clinic and also dispensed for the patients to go home with.
Okay.
We have a range of medications and we usually do prescriptions here or deliveries if need be.
Oh yeah,
Yes.
I like that. Okay, all right. And then I can see
Next
X-ray.
will be our radiology services.
Okay.
The first room is our X-ray, unit, where we have in-house X-ray facilities for anyone who needs either emergency or a planned imaging that needs to be done.
Can we go? Because they usually say, X-ray, stay away.
It is safe now. We've turned it off,
it is
and
safe
we
now.
usually have the sign there.
Okay, and we have a lovely lady here. It's really cool. It's like nice. Oh, the AC is on.
Yes.
Does it have to be like on the entire?
Especially when the machine is on, because we don't want them to overheat or any electrical issues.
Okay.
So yes, our radiology department is usually a bit cooler than the other departments because of that.
Oh, I like that.
Yes.
All right. I know majority of the times when you enter these rooms, they're very intimidating, based on the equipment
It
that
shouldn't
we
be.
usually see. Yeah.
Yes.
Okay.
It shouldn't be, and our staff, the radiologists and the radiographers, usually guide you through what's needed. And if you need a bit of time, if it's not an emergency session, they take you through what's needed and help you calm down. And you can have a well-done image that's going to help in your care.
Okay, so in here, chest x-rays we usually see, and
Yes.
what else?
We can do chest x-rays, limb x-rays for any emergencies or planned procedures.
Procedures,
Yes.
okay, all right, and of course all the equipment, everything is safe now.
Yes,
That we're
now
in
it's
here.
safe, now it's
Okay.
off. Usually there's a process whenever that needs to be done.
All right, and then I can see like, there's another tiny room over there.
So that's where the technician is during the imaging procedure, because it's shielded to keep her safe.
Yes.
Outside.
Okay. Yeah, she doesn't have to be here because of the
Yes.
rays. What usually happens, by the way, like on the rays and all those things? Why are we always told stay far?
Yes, there are a number of things. Radiation can cause some side effects, which we really need to intervene, but to be on the safe side, we try to minimize as much X-rays that you are exposed to during the course of your lifetime, and especially for our staff to keep them safe, because they have to do this frequently.
I like that, and keep her safe. Okay, all right, because we need her services anyway, right?
Yes.
Okay, all right. So we're going to the
next department is still within her purview. That will be the
all right. Still her office. Okay.
Yes.
Do you want to just so that we're not in your way?
In her way.
Okay. All right.
So this is the ultrasound department.
Okay. They're always way cooler than here, but I mean in terms of.
So this is where we do our ultrasonography, ultrasounds, especially women with maternity cases or any other person with abdominal issues, limb or any swellings that needs to be checked out. And this is free of radiation. Can be done also as an emergency procedure or a planned procedure again.
Okay.
Yes.
All right. Anything else? Oh yeah, like said, pregnant mothers come get their scans. You know, majority of them are very curious. It's like 4 months in, I want to see my baby.
Yes.
Okay.
You can have that as indicated by your primary doctor, either the gynecologist or the family physician who sent you. Yes, we do follow up on ultrasounds as required.
Okay. Any other screening? Breast cancer, maybe?
Yes, so it's the same machine that will be used in our wellness clinics, especially for things like breast ultrasounds for women below the age of 40, and also sometimes checking other organs like the kidney and the liver for certain high-risk patients.
All right. Like I said, women below 40.
Yes.
Like, what's the minimum age?
So usually below 40, we try to keep it to ultrasound because of other reasons. And anyone above 40, we do the mammograms, and that we usually liaise with also our main hospital for the mammography.
Okay.
Yes. Some of the services of cardiology can be done here, and there's another room for cardiology for heart-related conditions and testings.
Look at that. Hashtag technology and advancements in technology and all those things. And I like that because, again, majority of the times when you hear of the term like a neighborhood clinic, we assume you'll just get, you know, the bare minimum basic services like check your blood pressure, temperature, and all those things, and then you're referred to a bigger hospital. But here you get all of those services.
Yes, we've tried to make it easy for whenever you need a health checkup. We try to bring everything closer to the residential places.
I like that. Okay, all right. Thank you so much. We've been too much in your space. All right, thank you so much. Okay.
Next, we'll proceed to our lab services, which is this way.
All right. And you know, when we were coming in, there's something that I noticed, right? It's the stress, something, I forgot the name, the stress
test.
Yes. What exactly is that?
That's one of the tests to check on the heart conditions. So it's an exercise sort of routine that you've done, and you check how your heart beats, and we'll get to that in one of the rooms.
Okay, on the other side. I was just curious about it. I'm like, I've never seen something like that, but okay. All right.
So this is our laboratory section where any blood work can be taken from here, any other tissue samples can be taken from here, and processed from here.
All right.
Yes.
And then I can read phlebotomy. I have no clue what that means.
That's just a fancy word for blood drawing.
Okay.
Yes, or medical term for it. And this is where the patients who can walk and able to walk to designated station, that's where we come to take the samples from. For other emergencies, we may need to do those procedures wherever the patient is. So either in the treatment room or in the consultation room.
All right. Can we be like more intrusive and just walk in? Are we allowed to
Ideally, not whenever there's a procedure going on, but I'll have to ask the in-charge.
All right. I mean, we don't have to, so that we don't mess up with his work, and also, you know, hygiene, sanitation, all those things.
For safety.
Okay, cool. All right, but we've seen what that happens and where you can get your blood drawn and all those things. Okay, all right.
So proceeding to the next section, we usually have the waiting areas around the clinic. But the first other unit is the dental. Room.
I wonder whether there's someone.
We can go in.
Okay. There's no patient. Hi. We are invading. Okay. All right. So here we are, Dr. This is like really well lit. You know. Okay. All right. So that you're able to see behind our teeth.
That's the idea.
Okay.
So our in-house dental surgeon usually does the procedures, and I'll probably leave it up to him to explain what fancy things he does.
I mean, listen, it is a lot, but fine. Okay, just go ahead, because this is like fancy. Yeah, for those people who are scared to go to a dentist, this is, really cool.
This is paradise in a small room. So this is the dental chair. It's a basic equipment for most dentists, mechanically operated. There's a gas chamber over there, usually the patient sits there. And then we have a variety of tools which we put in our machine here. They are all in storage right there.
Okay.
If you wanted, I could show you some.
It's all right. It's okay. Yeah.
That's what we do. We are capable of doing restorative work, aesthetic work, prosthetic work, orthodontics, endodontics. Basically a lot of things, even surgeries here.
Oh, really?
Yeah, we can do
Oh, nice.
here.
Okay. Hey, orthodontics, big words, but it's fine. I'm really curious about this. I saw this earlier on and I was like, is that like some fancy type of camera? I don't know. I wonder where that...
This is an X-ray machine.
Okay.
It's called an IOPA for short. It's used for taking small X-rays of the teeth.
Okay.
So you just sit here, we put for you a lead apron, and then we aim it in the tooth we want.
Yeah.
And then we take the X-ray of it.
Okay, I like that. All right, this is nice. This is nice. You rarely get this in like your neighborhood clinic, so
no, you don't.
This is really nice.
With some of the equipment we have in store.
Yeah.
Really specialized.
Yeah.
You don't really get.
More reason why you need to come here. Okay. Yeah. All right. So we'll leave you to it. Yes, you want to
come and see Dr. Sam at least twice a year, and on top of the wellness packages that we have.
Absolutely.
Part of it is also a dental screen, and he can advise you on whatever procedure you need.
Yeah.
Or if you're doing a good job, he'll tell you you're doing a good job.
Thank you, Dr. Sam. Okay. So we're gonna go to, because there's a lot that we need to see here. Okay.
Yes.
All right. So that is the dental.
That's the dental department.
Yeah. Okay.
And lastly, we can proceed to the cardiology section.
Yes. Yes.
Where you were asking about the stress.
Yeah, the stress test. I'm like, I have never seen that. So
that's where, whenever a patient, part of the wellness package or part of the consultation with the cardiologist who comes in, they'll come, get a consult, do the test, be advised on what the next step
they need.
is.
Okay.
Yes.
All right. I like that. This is your office.
This is one of the consultation rooms.
Okay.
Where we myself and the other specialties come in for the consultations and procedures if need be.
Okay. All right. So consultation 1, 2, 3. Oh, okay. So everything that you need, clearly, you can't come in and then you're told you have to wait because
we try to make it as convenient as possible, reduce our waiting times. Unlike other clinics, so that's what we're trying to specialize.
And I think which is like the main reason why having like a neighborhood clinic is important, because people want convenience so that they don't have to travel long distances to get the services that they need. Okay.
Especially when you're in pain or distress, you don't want another added advantage of distance to be a barrier to you getting care.
Absolutely. Okay, so cardiology, you said
at the last one.
Okay. All right. And this is really nice. Doesn't even look like a hospital if you ask me. Okay, this is for staff. We can't go in.
So
okay. All right.
Where the fancy acronyms for what our cardiology team uses. So this is where the stress test is done, and also the ECG, pretty much the electrical activity of your heart.
Okay. And like we saw on the ultrasound. So there's some tests maybe that can be done there and others over here.
At the ultrasound area, it's something called an echo for the heart, for the cardiology checkups. And that's also just having a visual look of the heart structure itself.
Okay.
Yes.
All right. I like that. Do we go in?
Yes, you can come and have a look.
Okay. All right.
But it's pretty similar to the other rooms.
Yes, I'm cute. But the rooms are pretty much big enough. Okay. All right. So there's a bed. Okay. All right.
This is where the bed is, and that's where the machine will be set up when we have a client who's been booked in.
Okay.
Yes.
All right. So everything will be set up here. Okay.
Yes. Both the ECG and the stress test.
Yeah. And can we just talk about how important that is, and especially having that in sort of like a neighborhood clinic, because we usually see that in like really, really big hospitals, but having that here. How important and what are some of the solutions that you're looking forward to?
In terms of lifestyle diseases where heart conditions are pretty much the mainstay of that, we try to bring it closer to where people live. So in the home, it's easier to advise a patient closer to the home where they're more comfortable, avoiding the stress of commuting or going to the busy clinics that can throw off your assessment. And also we want to make it easy for people to do this more frequently, especially when there's no harm to doing it. If you're able to do it closer to home, the better.
So just talking about some of the lifestyle diseases that, are pretty common, and, what we need to do just to make sure, number one, that we prevent, because again, like Dr. Sam said, now we're moving from curative to preventive, right? So what are some of these, common things that you usually see?
So the common conditions that we see, especially in our wellness program, are usually things like diabetes, high blood pressure, arthritis conditions. For others, it's people who have high risk of family histories of cancers and things like that, and they just want to be careful or preempt any complications. So those are the kinds of cases we see.
That you see a lot,
With that said, most of our patients are also doing well, healthy, and we'd like to keep them that way. So a part of the wellness package is not just the tests, it's also the planning for the next year. What are we going to do to keep it this way? Or if you already have a condition, what are we going to do not to make it worse, to make you feel better, to make you cope with it better.
All right. So I'm especially curious about your wellness package, right? Because I want to believe like there's sort of like different levels. Of the same that people just need to be aware of, because again, like we're saying, it's important for us to be mindful about how we're living our lives first of all, but also understand that these are the services and the different packages that are available.
So for the wellness screen, there are sort of tiered at different prices and also different tests for women versus men, and also depending on the age groups, below 40, above 40, and plus some special tests. So some of the screenings we do, like I mentioned, when you come in, you have your blood pressure taken, we send you for a blood sugar screening, for the cancer screening, like for women, there will be screening for breast cancer, either go for the ultrasound or the mammography. There's a screening for intestinal cancer, what we call colon cancer. And then there are other tests, the ECG, the stress test, that can be done also.
That can be done. Okay, all right. Your office.
So, welcome to the office.
Okay. Mind if I sit?
Yes, have a seat.
All right. Thanks, Doc. So, and how often then should people go for their, sort of like a wellness, checkup, for example, or test?
Preferably, we say once a year, but that could depend on your age, your gender, what family history you may have, what risk profile you may have. So for some things, if you're a smoker, if you a smoker versus a non-smoker, there'll be different tests that the smoker may need to do as opposed to the non-smoker. So that's what I mean by risk profile. With gender, we already alluded to them, like for the breast cancer screening with the ultrasounds or mammography. Every 2 years or so can be done if that is if the initial one was normal or if you've never done it before. Things like pap smear for cancer screening, that can be done every 3 years or so, depending on the type of test you do. So the interval and frequency can be wide, and that's why it's important to discuss with your primary doctor. Just come in, have a consultation, and you plan on whatever package is appropriate for you.
All right. And of course, I'm also curious about nutrition and exercise as well. That is part of like self-consultation.
So that's, like I mentioned, it's part of the wellness package. It's not just the test, it's also the planning going forward. And a major part of lifestyle diseases is usually diet, physical activity, sleep, moods, mental health issues. So those are also taken care of as part of it. So you have the consultation, there'll be a resident dietitian who comes in, has a discussion with you. If there's any meal planning or any evaluation that you need to optimize your dieting, that can be done. There's also a psychology team that can screen for any mental health issues and discuss on the plan forward. So yes, so with a wellness check, and I'd like to sort of a myth that it's just a test, but it's more than just that.
Okay.
Yes.
All right. So then, as we bring this to a close, because again, we do not want to keep you for too long, finishing our chat, because I can see there's also like we said, like a lounge where people can just sit and relax. So can we just go over there, relax, as we bring this to a close, so that you also tell us, because like we've talked more on the preventive aspect and how important that is, but then again, when it comes to curative, because I'm pretty sure lots of people who are watching us at home are thinking, okay, so if I go there, will I get, first of all, treatment and, you know, like medication? I know we talked about the pharmacy and all those things, but the whole, you know, curative aspect of the same, right?
Yes,
okay, because we don't want to keep you here for too long. Because even as we talk about, like, you know, nutrition and all those things, okay, that's pretty busy, but it's fine. So what is it that then you would tell people? Because again, majority of the times, like we're saying, we're becoming very sedentary. We want to focus more on, you know, the preventive aspect of the same, but sometimes there's some people who don't know where to start, what to do, just to make it easier for them. You know, even as they, you know, move on the day-to-day activity.
So I'd say come in as frequently as you can. We don't bite. We always welcome, even if it's just for a chat. We can have that chat. And I'd say do this, when you're doing this frequently, in every clinic encounter, there's always some sort of screening happening, and your nurse, your nursing assistant, your dental surgeon or dental assistant will always direct you on whether you need to be more aggressive with something that they can pick up during one of those chats. So yes, do come in and just have the chat. You may not specifically be coming in for a wellness check. You may be coming in for a cold or a stomach bug. During that assessment, there are other things that you can discuss with the staff here.
I like that. All right, Dr. So what is it that you will tell people? Because again, like I said, we do not want to keep you for too long. And we need to go. So what is it that you will tell, you know, the people who are watching us this morning and wondering,
So I'd say we are a full spectrum clinic. So whatever service you need, pass by when we give you. The wellness check is just one aspect of it. We are trying to specialize in it, but it doesn't mean that's the only thing that we do. Yes.
All right. So come and get your...
For any emergencies or any planned visits, always pass by.
All right. Okay. And someone who's like, okay, so where exactly are you guys located?
We are at in Karen on Langat Road, Bina Complex, second floor. All
right, come there and get all these services that you need. Dr. Logan, thank you. Thank you so much for your time. Let's allow you to go back to to work, even as we say goodbye, right? All right, and thank you for watching us until the end of the show. We have to let Dr. Logan do his work, all right? But remember, Dr. Logan Rabogi, who is a consultant family physician, here taking us through the entire facility and all the services that you can get. For those of you who are curious to understand what the stress, what was it called? The stress test. Stress test is all about. Now you know. So my name is Winnie Lubembe. Enjoy the rest of your viewing, and of course I'll see you tomorrow same time, same place, right here on your world. Until next time, goodbye. I'm gonna get my wellness checkup. Goodbye.